about them. And they offered me these new Bluetooth hearing aids that would actually be controlled by my cell phone. And not only could they be controlled by my cell phone, but I could have conversations through my hearing aids with anybody on the phone. I can adjust volume, I can listen to music, I can listen to books on tape. It was exciting stuff, and I was ready for these new hearing aids until they gave me the price, $4,000 a piece. So I thought, gee, you know what, it's before Christmas, I have 8 kids, I have 14 grandkids. Leslie's kind of last in line when it comes to purchases. And so I walked out the door without getting them. Then I thought, when I got home, you know, I teach about CareCredit. I'm going to Google CareCredit and see what audiologists in my area take it, and then I'm going to see if I can get a CareCredit line. Sure enough, the audiologist that I had just left was on that list. And in about 5 minutes, I was able to key in my information and print out a little CareCredit temporary paper credit card number. And I went back and I said, you know, you let $8,000 walk out the door. You didn't even offer me any kind of financing. You didn't even mention that there were alternative ways of paying for this really great thing that I wanted. So I just wanted, before I go on to regulations, encourage you that you know, if you're not letting your patients know that you offer alternative means of paying for their care, they may be walking out the door leaving thousands of dollars of treatment undone because they didn't know, or no one mentioned to them, or there was nothing, no signage that pointed to them being able to get some kind of commercial patient financing. So if you do take the commercial patient financing, remember, you can only apply charges to that credit card